Hello, True Health Seeker, and welcome to another exciting episode of the Learn True Health podcast. I'm very excited for you to hear our interview today with Reed Davis, the founder of Functional Diagnostic Nutrition. A few months ago, I interviewed one of his graduates who practices as a health coach with this unique ability to do functional lab testing and then help their clients to find those healing opportunities that the labs present. It's a different philosophy, a different lens that these health coaches look through to see how they can best serve their clients to finally resolve the metabolic chaos that's been going on. We often treat symptoms in our medical system. Someone has a thyroid condition, for example, and they think that that's the root cause, and so they're treating the thyroid. But thyroid dysfunction comes from somewhere else. What caused the thyroid to have a dysfunction? And there are dozens of root causes. The functional diagnostic nutrition looks to solve that. So today we're going to dive into what is functional diagnostic nutrition and how can it help you to achieve the best health possible. Now, for those who are already health coaches or in the holistic health field, you're gonna love learning about Reed's program. He has a wonderful online certification program where he teaches you how to do these labs, how to interpret them, and how to then help the clients to get the results they're looking for through lifestyle, diet, and when needed, supplementation. If you're not in the holistic health space and you're not interested in making a career out of helping people, like becoming a health coach, you will still enjoy today's interview because he does teach a lot of wonderful things. And he's told me that some people even take his course just to learn these tools for themselves, which I thought was very valuable. After interviewing him, I enrolled in his program and I jumped in, and I'm already in module 2 and I'm loving it. I'm absolutely loving it. I am learning so much. What I really like about his program is it's all rubber hits the road. There's no fluff. You jump straight in and you begin learning. And I've been studying with naturopaths and doctors and reading tons of books and going to health lectures and obviously doing over 300 interviews with doctors. And in my first few days of being in his course, I have learned stuff I've never heard of before. So it's really, really exciting. If you are a health coach, I highly recommend checking out his course because, as you know, I'm a health coach. I've been doing this for several years, and I always felt like there was a piece missing. This piece of looking at things objectively through the lens of proper labs. And so Reed talks about this today in the show. You're going to really like the kinds of labs that he does. It's not the kind of labs that you're ever used to going to your doctor. These are totally different, and they allow us to see where the metabolic chaos is, and in some cases actually let us find the root cause. But regardless of whether we find the root cause or not, they will allow us to see what we need to see in order to make the appropriate changes to support the body and coming back into balance. And that's very exciting. So enjoy today's interview, and please check out the link learntruehealth.com/FDN, as in functional diagnostic nutrition. That's learntruehealth.com/FDN. Excellent. Enjoy today's interview. Welcome to the Learn True Health podcast. I'm your host, Ashley James. This is episode 376. I am very excited for today's guest. We have with us Reed Davis. He's the founder of Functional Diagnostic Nutrition, an amazing company that helps people to become certified in functional nutrition. And I definitely want to dive into that because we have a lot of health coaches that listen, and this is a wonderful adjunct to those who are in the holistic health space, or for people who want to get in the holistic health space. It's a wonderful course that they can take. But for those who just want to get their own health back, and that's why they're listening, this episode is also perfect for you because we're going to be talking about lab testing and the things that you should know about to help you to optimize your health, the things that going to a mainstream medical doctor or practitioner, they just wouldn't know to provide you. And so Reed's going to enlighten us today. Reed, welcome to the show.
Welcome. Thanks so much for having me here, Ashley. It's a real pleasure. Look forward to
Absolutely.
trying to help some people.
Yeah. And before we got started, you were telling me a bit about where you live, which is a paradise up in the mountains. You're living off the grid and you're using a satellite phone. So, so far, the connection's been wonderful. And every time we hear a little bit of a delay on the line, we'll just remember that you are living in absolute paradise on a lake in the mountains, totally off the grid. And we so appreciate that you're taking the time to educate us today.
Thanks again. I'm happy to answer anything I can, tell you any history. It's about helping people and trying to walk the talk, so I'm here for you and your pleasure.
Absolutely. Well, I'd love to start by hearing your story. You are a certified nutritional therapist, you're a holistic health practitioner. You founded this wonderful company that helps people to learn how they can do these lab tests for themselves and for their clients, and then what to do once they have the lab results, which I think is the most important thing, right? It's good to have the lab testing, but then
Hmm.
what do we do? Like, okay, so now I see that my liver enzymes are high. Like, what do we do? So you have a wonderful course that helps people to learn functional nutrition. How did you start? What happened in your life that led you to want to do this?
Yeah, thanks so much. It is an amazing course in lab work and natural protocols to fix what you find. But it was a long time coming. Back in the 90s, I was doing environmental law. I came out of a law program at University of San Diego and went right to work saving the planet, birds, bees, air, water, trees. What can we do to clean up the planet? And it's very rewarding work. And frankly, I made millions of dollars for the owners, but not for myself. As I increased their business, my income didn't go up that much. And Southern California is a very expensive place to live. And so I was looking around for a way where I could be my own boss, work for myself, but also continue the work. So I turned my attention from saving the planet to people. Like, well, what's this environment? If it's killing off the birds and bees and air and water and trees and things, what's it doing to people, including myself? Like, what's it
Mm.
doing to me? And I'm getting older too, right? So back then I was probably in my 40s, but I was, again, working hard. And I went to work, I changed jobs. I went to work at a clinic. It's a wellness clinic or wellness center in Southern California, in San Diego area. It's beautiful and people were lovely. And I was really hired to run the business and help expand the business. But the owner, who was a chiropractor, she allowed me to go with her kind of as an assistant she was getting a diplomate in nutrition for her chiropractic work, and said, hey, you can come along and you can get certified too, not as a physician. But I did that, and this was remarkable. Actually, you'll love this, because she let me work on her patients in between classes. So I'd go and do a lesson, let's say on detoxification, come back, and I had access to her patients to talk to them about their health and find out what's going on and see if I could help them with this training that I was getting. And I've had many other trainings since, as you mentioned. I've kind of been a certificate collector of sorts, but it's all because, and I think everyone listening probably is in a way a learn freak. I call it. They just never satisfied with what I know there's a deeper layer. There's somewhere else, something else I can learn, and so I was like that too. But also in the clinic, now this is remarkable. Again, I had the ability to help clients, and I fell in love with that side of it. So I turned my attention, instead of just running the clinic and helping it grow and things like that. I mean, I still had to do that, but I fell in love with the clinical side. That means working face to face with people. And so one of the things I noticed right away was that almost everybody walking in the door for their pain or whatever it was, they had multiple complaints, and they'd been to multiple practitioners trying to get some resolution or solutions for their problem. Some had been to 10 doctors already. And that just blew my mind. And even though I was a neophyte, that was 20 years ago, I said to myself and to them even, look, I'm going to be the last person you need to see. We're going to figure this out. And I've been very good at the legal research and writing, and I can understand fairly complex things and try to make it easy for people. So that was another part of my job at the time, was just called it, patient educator. So I got to look at very complex things, break it down, and try to explain it to people so that they could go out and do the things it took to get well. And I was just, again, very fortunate the way the stars lined up, or however you want to put it. I met doctors who were running alternative lab work. So back then, 20 years ago, there was just standard medicine and alternative, also known as like quackery. Some of these doctors I learned from were not very well respected at the time, but they were pioneering and doing really important work, especially with some of the labs that were coming out, the saliva testing, the urine testing, the stool testing, things that were, I would say, above and beyond normal blood chemistry. Because some of these people coming in and they're really kind of sick, they just feel lousy all the time, and things about the way they look or the way they feel that they're not happy with. And their physicians were saying, your blood work looks normal, everything looks fine, you're just getting older. Or, here's you've heard that before, right?
Right. Well, and we're definitely going to get into this, like what is normal, because they're waiting till you're in a disease state so they can give you a drug. So if you're unhealthy, but you're not yet sick enough to be put on a drug to manage the disease, then they're going to tell you that you're fine. That's if you go to a mainstream medical doctor.
Right. So you're considered by them to be subclinical. You haven't reached that point where your blood work looks so out of whack that they can diagnose you. So this is another beauty of our work, as I've been doing this for 20 years, Ashley, is there is no medical diagnosis or treatment for that specific thing, just for feeling lousy and you're overweight and you're tired and you're, maybe there's stuff going on with your sinuses, allergies, moodiness, irritability, digestive problems, all these things. But you're not at that point where you need to be referred to a gastroenterologist or something, the way standard medicine works. So back to the story, I'm seeing people in the office now, and I started going out into the public and recruiting. So I bought a bone density testing machine, and I started doing that 2 days a week. The clinic was open Monday, Wednesday, Friday, and I worked very hard. I do 12, 14 hours a day easily. I worked a lot of weekends. And a couple of days a week I would go out, and for 5 years I went out twice a week to these grocery stores. There was a small chain, about 30 stores, and I would just go from one to the next and test people for their bone density. And this was mostly women between, I'd say, 40 and 60, because that's who gets checked, and they're getting early checks. And I'd get certified in that part, to use that machine, kind of radiology, limited tech certificate. And I was doing this testing, and then I was helping those women with that problem, like if they had low bone density. And I got into the hormones and the immune system and digestion and detoxification, and I learned how to run the labs. So again, I was very fortunate to be working with some physicians who let me run labs under their license, as their protege, if you will, actually as their alter ego, because their licensure restricted them from what they could do or say for a person. And this is still happening today. Yeah, you're laughing, but I looked even just this past weekend. I was up in your neck of the woods. I was at a MedFit tour at the Washington Athletic Club in Seattle, and I was speaking to a group up there, about 100 personal trainers and some physicians. And one physician said, I feel like my medical license are handcuffs. I'm just about ready to give up my license because I want to do what's really right for people.
Yeah.
So 20 years ago, it was worse. Doctors were, they're just so tied up to this model of diagnose, treat, very small, specific thing, and almost always it's writing a prescription. So I was actually like an alter ego. I got to say to those people anything, like forget the diagnosis. What's really wrong? Again, the saliva testing, urine testing, stool testing, looking at hormone, immune, digestion, detoxification, energy production, and autonomic balance, the sympathetic and parasympathetic. So I ran thousands of those labs on thousands of people, mostly women, because that's who seemed most interested. But then when we got some good results, and actually some miracle cases early on, just unbelievable things happened that told me I was on the right track. And then they'd bring in their husbands, they'd bring in their kids. If you want, I could tell you a quick story about an early case that gave me tremendous faith and hope and belief in what I was doing. A lady comes into the chiropractic office, and I would walk the patient back to the treatment room. And I was also trained. I took a course in myofascial release, so I could do some specialized trigger point therapy on their necks and upper shoulders and things before they got their chiropractic adjustment. And one lady, I was taken back, and I could just tell she was not feeling right. She was depressed, and I asked, "What's wrong?" She said, "Reed, it's this weight. It's just 40 pounds, and I'm really depressed about it." Well, what are you doing? Well, I can't do anything because I'm on this medication for the hives. It was a steroid that makes me fat. And so I talked to my doctor yesterday, she said, and he said, "Lady, you have your choice. You're going to be overweight or you're going to have the hives. Take your pick." And so, yeah, you can imagine. So she just really was distraught. She said, and I told him that was really depressing, and he offered me to write a prescription for antidepressants.
Oh, of course.
And you can, yeah. So check this out. So again, this is a long time ago. I didn't know really exactly what I was doing. I was learning, but I didn't know what I was doing, but I was doing an awful lot of it too. And so I said, well, Susan, did anyone ever try to find out why you get the hives? And her neck just about snapped, her head just about snapped off her neck. She was, well, what do you mean? I said, well, there's tests you can find out. Are you sensitive to something? Is there something in your environment? There's all kinds of ways to investigate that. That's what I do. I'm like a health detective. She goes, well, no one's ever mentioned that. And so anyway, to get to the chase, we had her take home a couple test kits, found out some things that she was very sensitive to, got her off of those things, mostly dietary. And within 2 weeks, she was off her medication. And she told her doctor, I'm never going back on that again. I found out what the problem is, and I'm avoiding it. And then 2 weeks after that, not only was she off the medication, she was doing two things that she hadn't done in a couple of years. One was take a hot shower, because even on the meds, she got the hives. The other was working out to the point of, and the other was working out to the point of perspiration, because even on the meds, she got the hives. So it completely changed her life. She became a happy person. She started losing weight. She started feeling like her old self and thing. Now, I have to add that there's some other labs and, the hormones and the immune and digestion. There's a lot of things you could tune up on a person. But that just told me then I was on the right track. And I have just so many stories like that where early on I didn't know it all, but I was figuring out a system of investigation, where to look for these underlying causes and conditions, instead of, here's something for the hives, and if that depresses you because you gained 40 pounds, here's something for the depression. And it's such a contrast, as you well know, eh?
I love it. I love that. And that was your early on experience, which got you so excited about helping people, but that you were shocked to find out that when people go to their mainstream doctor, they wait till they're sick, put them on a drug, and then when they have a side effect, they put them on another drug for the side effect, and so on and so forth, instead of trying to figure out how to solve it. And if we look in to the history of allopathic medicine, about 150 years ago, and start to look back to the beginning of what is now, MD medicine, right? If we look at the history, we see that, and this is not conspiracy theory, this is fact. We see that a person, it was Carnegie, who owned a pharmaceutical company, is the one that invested in making sure that the education, he invested in all the universities that taught medical doctors to only teach what basically how to prescribe drugs. And so to this day, the education of doctors is largely manipulated by the pharmaceutical companies. They don't want doctors to learn how to get to the root cause of chronic illness. And I love allopathic medicine for emergencies, for some surgeries, for, when it's necessary, and especially emergency medicine. And in, some infections, like that's where they shine. But take a chronic illness to an MD, their wheelhouse, their tool set is drugs that manage symptoms, not most of the time not getting to the root cause, especially when it comes to more sensitive tests, like you said, and things like food sensitivities or understanding genetics, understanding diet and nutrition. They don't have an education around that. But unfortunately, they have a hubris, not all of them, but some of them have a hubris to assume that they know everything about health because they paid so much for their education, right? I have had a few MDs on the show who've said to me, I really thought I knew everything. And they really do. They think they know everything. So when you come to them with hives, they don't question what's causing the hives. They just assume, okay, you have hives, you're just going to have it for the rest of your life. Here's a drug. Same with my type 2 diabetes. I had, and polycystic ovarian syndrome and infertility, all the problems I had, all the MDs told me was that we can manage it with drugs, and I will be that way the rest of my life, and I will never have kids. And I told you before we hit record, because you asked me about my personal story, but that it was because I veered off and started to look for holistic solutions that I was able to resolve all of them, all the things that the MDs said were my life sentences, basically. So I love that early on you saw that there's a huge need for functional diagnostic nutrition. So what happened next? So you were having these aha moments when you were working with the clients in the clinic. What led you to want to start functional diagnostic nutrition?
Yeah, sure. I wanted to just follow up a bit on what you said first. The fact that our allopathic physicians, they're the best at what they do. And they want to help you. They save lives every single day. If you get off an airplane from West Africa and your temperature's 106 and you're bleeding out of your eyeballs or something, you don't call your nutritionist. You go for the best standard of care you possibly could find. And our hospitals and doctors' offices are full of people who could really help you at that point. Same thing if you have a car accident and your bone is sticking out of the arm bleeding, you don't call your health coach. You go get it fixed. And they're so fantastic at that, right? So that's the kind of we want to keep those things in mind. But the next thing for me was just the sheer grind. I mean, I was just grinding for years. I didn't, stop to think about what kind of a big movement I could start or something like that. I was really enjoying myself, earning a very good living, building one of the busiest, we'll call it a nutrition practice in the country, in the U.S., again, in San Diego. And I was just doing my thing, working in the office, really helping all the patients that were coming in, learning, how to teach them and how to, educate them in plain English on the things that they could do. What's really big, the concept in the chiropractic office and wellness center, like we had other doctors, acupuncture, we even had an osteopath, but it's not what you do in the office. It's what you do at home in between office visits. And that's what I became an expert at. And so, or at least, a guy with a plan, a guy with a system, because it was all based on observation. So if you run thousands of labs on thousands of people, you're going to learn a few things. And what I learned is where the alternative practitioners of the day were leaving blanks. So there's these gaps as a person with a health problem. There are gaps. If you go to I call it the cycle of trial and error, actually. So you go to a physician, he says, "Oh, your blood work looks normal," or even if he says it looks abnormal, the answer is just a prescription. It's for to treat the paper in most, like thyroid's a perfect example. Oh, you have a cluster of symptoms. It sounds like thyroid, so they run a thyroid test. Yep, pat myself in the back. You have hypothyroid. Here's your thyroid medication, and it treats the paper. Definitely, they can adjust the doses to get the numbers on the paper to look what they want. That doesn't make the person any better. It's treating the test results and the symptoms, not the person. So the best blessing I had was not being able to write a prescription, not being a doctor. At first I thought, oh, I should be a doctor, then I could really help these people. No, grinding it out for years and years in the office, figuring out what's really, running the labs to figure out what's really wrong, and then how to fix it. What does that person need to go home and do between the doctor's visits? And I that's where I came up with that Dress for Health Success system, the DRESS, and we can get into that, what that is. That's the lifestyle medicine that is now bandied about by lots of pundits, people who might have gone and got a training in something. I mean, even people who take my course, they're much better educated once they're done. But grinding it out, being on the discovery level was happy days, just working hard. So you asked, how to finally turn that into FDN. I was out lecturing, not only doing my screenings with the bone density machine, and I invented other screenings just to get to know people and get them doing some lab work, get them running some saliva and urine testing, which is easy to take home. It's not expensive, and everyone can do it. And so anyone can run these labs. And getting the information, identifying, this is the key phrase, healing opportunities. Like what's really wrong. Again, if your hormones are out of balance, if you're not breaking down and assimilating food very well, if your liver is congested, you won't be detoxifying your body, and on and on. If the immune system is overactive or underactive. These are not medical diagnoses. They're just identifying healing opportunities, things that a person can fix. And of course, it isn't just but one of the trainings I took taught us to substitute drugs with supplements. And I tried that for a while too, and that didn't work. So it's much more than just, naturopathic medicine should be much more than just, well, here's the test, here's what's wrong on the paper, and here's some supplements that will fix it versus here's some drugs that will fix it. That's not what worked for me. It took, again, the whole entire lifestyle medicine thing. So I started figuring out, how do I know what is the right diet for everybody? Everyone has to eat. You're made of food. The reason, I used to weigh 8 pounds when I was born. Now I weigh 198 pounds. Pretty big guy. So where'd that extra weight come? It came from food. You ate food and it built a body. And so that's really important. Then also rest or sleep, but rest, knowing how to really get good deep non-REM rest is critical to having a healthy body. And then the exercise. I became a personal fitness trainer and all of that, and learning about the physical body. And then of course another letter is, so that's diet, rest, exercise. DRESS it spells Dress for Health Success. So diet, rest, exercise, stress reduction, and then, of course, the supplements. And I put supplements last. They're what people want to start with, but I don't really believe that. They're important, but it's really the D, the R, the E, and the first S, stress reduction. You've heard that word stress before, right? You probably don't have any. But there's so many different kinds. So I learned about stress. Matter of fact, I read in 2001 an article in a naturopathic magazine that was responsible for 50% of office visits and up to 80% of chronic degenerative disease with some form of stress. So I looked into different types of stress, mental, emotional, physical trauma. And of course, what I specialize in is the environmental and biological, biochemical stressors, chemical stressors. And so it's really a holistic lifestyle program that was developed over years of working with people, finding out what works. How do you customize it? But base it on the actual healing opportunities that are discovered with the labs. And if you run thousands of labs on thousands of people, again, you pay attention. I made observations on who got better and who didn't. And it should be no surprise to anyone listening, those people who worked closest to the underlying cause were the ones who got better. But what's not so intuitive, and this is kind of where it takes a twist, that you really have to be observant, is people with the exact same set of symptoms can have them for completely different upstream dysfunction. So one person with a thyroid disorder where they're hypothyroid, in other words, their thyroid is not making enough T4, or it's making T4 but it's not converting into T3 properly. Those are basics. Well, why? Instead of just giving the medication, we want to know why. Well, what I discovered is that there's in 10 people, you might find 10 different reasons why. That's the not so intuitive part that helped me develop functional diagnostic nutrition, the entire program, which is the investigation, like which labs to run, and which observations can be capitalized on. So we're going to make some observations about healing opportunities. As long as we're given time, we can capitalize on those. Again, if you have a temperature of 106 and you're bleeding out of all orifices, don't call me. Go get checked out first. If you have a big bulge on your forehead, like some tumor growing, that needs attendant care, emergency care. You go get that handled. But then what? Well, you come back and we do a grounding program for you, this holistic functional diagnostic nutrition and the Dress for Health Success program. And so that took a lot of years.
Very cool. And so as you developed this, did you see when you applied the Dress for Health Success to everyone, that you got even better results?
Well, yeah, and today, I mean, 11 years ago, I was asked to teach this system. It wasn't good enough for one guy in California to be using it on. I mean, how many people could I actually serve? I had one of the busiest practices in the country. And I was told that by my vendors, the people that I did business with, especially a couple of the laboratories. They said, "Who the hell are you? No one does this much lab work. We have doctors' offices, and there's 5 doctors working there. And who are you again? You're a nutritionist in Southern California. You're doing all this lab work?" And well, yeah, I did it actually because I didn't know you can't do it. You know what I mean? Like you can't do that. Who are you? You can't do that. And I just would explain, how hard I like to work and the number of people I'm helping and the system that I was developing. And finally just became time to start teaching it to other practitioners. So I started deputizing just about anyone at first. There was a lot of they didn't call them health coaches back then. Now there's a lot of what they call health coaches. I think we're a pioneer in that area because they're allied practitioners. They're not medical doctors for the most part. We have personal trainers and people who do Reiki and nutrition and dietitians and nurses and physical therapists and you just name it, chiropractors and acupuncturists. So basically not MDs. Just what they want to focus on is underlying causes and conditions. Matter of fact, actually, real quickly, you were talking about the history. It's really important. In 1903, Thomas Edison, it's a very, very famous quote from the great inventor, who was right about a lot of things, but he was wrong about this. And I see people using this quote all over the place. It says, "The doctor of the future will give no medicine, but will interest his patients instead in care of the human frame, in diet, and in the cause and prevention of disease." Well, he's wrong. Doctors are still giving medicine. It's 113 years later. Well, when's the future? If it's not now, when is it? So if physicians are still just going to be giving medicine, who then is going to interest the person in the care of the human frame, in diet, and in the cause and prevention of disease? It's health coaches and allied practitioners. We're the ones. We're the army, if you will, saying we'll give the care of disease to physicians. We freely grant them full monopoly We don't care about disease. You guys you're the experts. You study disease, you study how to stop the symptoms that might kill someone. That's a good thing.
Mm-hmm.
Like they can do stuff that I can't do. I can't order a CT scan to see if you have tumors and all these other great things that they can do. Although some of that's a big waste of money. I had a client once who I mentioned to her that she was going to take this supplement, and it was, there's a possibility that you might get a little bit of vasodilation headaches. You might get some headaches if you take too much of this stuff. So back off. Go back down to the original dosage and things like that. And so about 3 weeks later, I'm talking to her, and she goes, "Oh, I'm going in for a brain scan for my headaches." I go, "What?" She goes, "Yeah, I called my doctor and I told him I've been having headaches for 3 weeks. He wants to give me a brain scan." I said, "Well, okay, you've 3 weeks. Like, how long have you been taking that supplement that I suggested to you?" He goes, "About 3 weeks." So like, doctors look for brain tumors or things, and we work in different ways. Like, I mean, that was I think you get the point I'm trying to make there. It's good to get your brain scanned, I guess. I can't order that test, but and it's good to have a doctor around who's licensed to do that. But we look for things in a different way. What are the healing opportunities? It's a different set of labs.
It's a different philosophy. Yeah, you're looking at it through a different lens, right? You're looking for the healing opportunities, and doctors are looking for what drugs can I prescribe. That's their tool set. So it's a different philosophy.
It's totally different. So again, back to this idea that there's gaps. People are caught in a cycle of trial and error. And if there isn't enough health coaches and allied practitioners around, the proof is in the fact that the population is actually getting more unhealthy. And drug use is getting more rampant. We have people being advertised to on television going to their doctors and saying, "Hey, I want to try this medication for whatever," and the doctor they're kind of market followers, like, well, okay, they're trying to meet the demand. I mean, they wouldn't just indiscriminately do it, but you get the point I'm trying to make. So we see the health of people getting worse. So a doctor I was talking to, a good guy, he said to me, "Reed, we're ranked 38th." No, he goes, in terms of health, United States is ranked second from the bottom of 48 civilized countries, or whatever, like that. Like, we're ranked second from the bottom. Why is that?
But we spend the most. We spend the most as a country. We spend the most on, okay, they call it healthcare, but it's disease management. And yet we are basically getting the worst results. And if it was a country, if we looked at each country like a company, like a business, like Amazon is a business, if Amazon was spending the most amount of money and getting the second to last worst results, like in terms of sales, retention, whatever, they would fire the CEO immediately and completely restructure their business, or they'd go out of business. But because it is a for-profit business, there's no sense, they don't want to change it because they're profiting. They'll say, you'll see these statistics, like if you were a type 1 diabetic, or if you were an insulin-dependent type 2 diabetic, they say the cost to be a diabetic is $12,500 on average per person per year.
Sure.
And they make it sound like it's a cost to the country, right? Like it's a cost, but in fact, it's a profit. A diabetic is profiting the industry that doesn't serve us, that is not getting results. So why would they want to change? They're profiting, right? But we are the people, as individuals, we are the ones getting screwed over because we're getting the second to least results in compared to all the other countries. And yet, but we
Yeah, we
can't
spend
like,
less.
right, but
Yeah.
we could go, yeah, we could go to a different country, spend less on health, but that would be costly to fly or drive to a different country depending on where you live. And so here we are. We're stuck, but we have to do something different, right? We don't want to leave the country
Hmm.
we're in for healthcare, although some people do, called medical tourism.
Hmm.
And so here we are. We have to understand that the system we have gets the second to worst results, and yet we pay the most for it. So we have to understand that we're stuck with that system, but we're not stuck with needing to go to an MD for absolutely everything. We have to understand, like you pointed out, wonderful, wonderful people to go to for certain things, and for healing opportunities, go to an allied practitioner like a health coach, a naturopath, a chiropractor. I shouldn't call it. I don't know about calling a naturopath an allied practitioner because they are legitimate doctors, but
Hmm.
they see it through a different lens. But going to someone other than a doctor that's just going to prescribe drugs. So we need to take our health into our own hands. That's why the listener is listening right now, so that they can become educated, and they can be highly informed and advocate for their own health. And I'll say one final thing on this, and I say it often,
Hmm.
but we have new listeners all the time. As
Hmm.
I've done all these interviews, which I've done over 370 interviews in the last few years,
Wow.
I I it dawned on me somewhere along the line that if you want to be a statistic, do what everyone else is doing. So the statistics right now are I believe it's like 1 in 3 people will get a cancer diagnosis in their lifetime. 1 in 3
Hmm.
people are obese, or overweight in an unhealthy way. 1 in 3 people have diabetes or pre-diabetic. I mean, it's basically, and then you look at heart disease. Excuse me, heart disease. My dad died of heart disease. My mom died of cancer. So both
Hmm.
two topics very close to my heart that we can help the listeners prevent. It's heart disease is 100% reversible and preventable. I interviewed Dr. Cadwell Esselstyn, a cardiologist who's in his 80s, who still practices today, helping people to reverse heart disease with diet. And so the point is that we can take action, but we have to remember that go we need to be salmon swimming upstream. If we do what everyone else is doing, we're going to
Hmm.
be a statistic. So we have to, be a little bit controversial, right? Go get some lab tests done
Yes.
that people that our regular doctor would like scoff at, maybe. Change our diet, change our lifestyle. Like look at that stress, look at exercise, look at all the things that the average person doesn't, in order to live a long, healthy life without disease. And so I'm so glad you're going to outline some great actionable steps we can take today, but that you created the Dress for Success system to help people see that there are pillars of health that they can take into their own hands every day to build their health. And then using the labs, you look for healing opportunities to target what the body is saying it needs to focus on.
Yeah, exactly. And so that was a mouthful, and very good. And you are a change maker. Someone's going to help affect change this system. Or let's just say the two systems can both exist. Again, it's not like we need to eliminate allopathic medicine. We just can't let that team have control over everything in us, because they will just make us consume. We just become consumers of
Mm-hmm.
their stuff.
Mm-hmm.
Like the province of Ontario, and we're both from Ontario, right, in
Yes.
Canada. And so I heard a statistic recently in the last couple of years that by 2020, 60% of the entire Ontario government's budget, 60% of the entire will go towards healthcare.
Wow.
And that by 2025, or somewhere in there, another 10 years, maybe 2030 even, it will be 80% of the entire government's budget will just go towards healthcare. In other words, everybody's going to be sort of on the medical dole, if you will. It's just where all the money's going to go. And it's a system where you're right. There's greed and a lot of profit motivation for that. So for the people who are on the receiving end of the check, like government's writing the check, and so who's getting the check? Who's getting paid? So we want to change people's thinking, and I also just kind of have to throw in that what we do is for profit also. Like I've learned to make a living helping people. It's an honest living, though. It's doing work that's very rewarding, that does some good in the world, and it will be a legacy. It will be passed on. And so you and I are of the same ilk. We're working together to affect those kind of changes. And you don't do it by going along with the pack. You do it by being somewhat controversial, or at least, hey, can't I ask some questions? Like if you go to a physician and he says, yep, I found your problem. You're hypothyroid. That's why you're tired and are constipated and gaining weight and can't lose it, and your hair's falling out and you feel sad. It's hypothyroid. Here's your medication. So if you say that, doctor, well, why is my thyroid underactive? We don't know. It's idiopathic. When you heard that word idiopathic, it means they're not looking for the answer. It really means we don't know, but it means they're not looking, because that's not how they operate. Again, the money, and it isn't, by the way, just the drug companies. It's insurance companies play a huge part in it, and that goes back to our original comments, Ashley, about physicians feel like they're wearing handcuffs, like they can't say anything else. They get reprimanded by the board. They can, if they're selling supplements out of their office or doing some of these things, alternative stuff insurance doesn't pay for, they can get a letter that says cease and desist, or we'll take your license away. And how many are brave enough to say, go ahead, take it. I'm going to do some good in the world, and you can keep it. They're just not that brave at this point. And so there's got to be another system, again, not to replace it, but to operate side by side. That can end up being a bigger system, the one that the people choose, when the people go to. So I've been a working class hero my whole life. I always admired them anyway, and that kind of a thing. I actually do ride a Harley Davidson through the mountains of Southern California, at least 3 times a week, and trying to do some good in the world and enjoy the lifestyle, walk the talk. So I can't say profits are a bad thing. I just say you can make an honest living helping people if you want to, and that's a big part of my course is showing how to people to do this as a profession. Most people would sign up for their own health and their family stuff. They just want to learn. It's very affordable, and so we've turned. I do these post-grad interviews, and I always ask every single graduate of my program, I personally interview. And I have for 11 years. So I've done thousands of interviews and asked, well, why'd you take the FDN course, and what did it mean to you? And like way more than half, I'd say 75% say, my own personal health challenges have been completely resolved or partially resolved, or, I'm working on it. I'm on my journey. I feel so much better, and I can't wait to share it with others. I'm going to go out there. Now I'm going to do this for a living. So we've had people start a business, or, augment their business, or shift from whatever they were doing for a living to doing this for a living. So it's okay to make money as long as you're doing some good in the world, in my opinion.
It is not evil to make. I think I want every single one of my listeners to live a life that they absolutely love and be well taken care of, to have the means, to have the amount of money that provides them with the ability to live their dreams, right? Money is not evil. It's what you do with it. And when you have to give your money, like I just paid my bills today, and so I just paid our health insurance, and we don't buy the most expensive, but we don't buy the most cheap, somewhere. And I always buy one that covers holistic medicine, but we're nowhere near reaching our deductible because we obviously don't use it a bunch, but we do go to our naturopath and our chiropractor, acupuncture, that kind of thing. And it's $1,500 a month for the 3 of us, for our family. And last year it was a different plan, and it was $1,800. And I'm like, every time I pay it, I just feel, I don't know, I feel resentment. I feel frustrated. I think to myself, why don't I just not have health insurance and then just save some money and put aside, or maybe do like those. There's all these different options, right? And I'm self-employed, obviously. Like I do the podcast and I'm a very hard worker to get this podcast, to be to help as many people as possible. That's a huge percentage of our income goes towards
Yeah.
medical expenses for a system that is broken, for a system that isn't getting results, right? So
Yes.
if the system was designed, if every practitioner had your course, right? So every practitioner in the entire world, even every MD knew what you taught and they practiced what you taught, our medical bills would be so small. It would save us so much money.
Yeah.
So every time I pay it, I get resentful because I'm paying a system that doesn't work. And now I'd be overjoyed to pay a functional medicine practitioner, and I want them to profit because they get results. So it's about results. It's evil when you have to
Yes.
give something or a company, you have to pay some money to something that gets very poor results and you feel like
Hmm.
you're ripped off. So it's more about feeling ripped off. Whereas with functional diagnostic nutrition, I know it gets results. Just like seeing a naturopath, I know I'm going to get significantly better results than seeing an MD for certain issues, right? So you want to go to the
Hmm.
right practitioner for the results you want. And I think that's just really important to understand that there are these allied practitioners out there. I've had listeners contact me that said, I never knew that naturopaths existed until I listened to your show. Like they just didn't know, right? Because it's not part of the
Yeah.
mainstream, I guess, you know, Hollywood, right?
Right.
And
Right.
TV and
Right.
media. The media we consume growing up is all about ER and Grey's Anatomy, and it's not, there's no show like following, acupuncturists around. I think that would be hilarious.
Hmm.
Yeah, I definitely want to get
Yeah.
into understanding a bit about the tests that you like. If you could give us some examples of lab tests
Sure.
that people, when they take your course, that they learn to order both for themselves and also for their clients, and what, like, to give give us a contrast compared to like what someone would get when they go to a MD versus when they're going to a functional diagnostic nutrition specialist.
Fantastic. So the place to start with the labs is, how do you think about it? Like what's because if you it's really a state of mind, or a we call FDN a methodology. So a methodology is a method with a way of thinking attached to it. There's a philosophy, or a state of mind that's required. And since we're not physicians, we can't diagnose and treat specific conditions. That would be practicing medicine without a license, and we don't want to. We want to just get to the underlying causes or conditions. Now, they're not always identifiable. So, the so called root cause, you hear people talking about this, you may never find the root cause. It could be really well hidden, or there just isn't enough tests. There's no one test, that's for sure. It's not this blood work that they're running. And we might be 50 or 100 years away from a blood test that tells you everything, if it ever happens. And we're definitely not in the land of Star Trek, where I don't know if you remember Dr. McCoy had that little thing and he would wave it over the patient's chest and it would go, and then, oh, it's this or that, and here's your shot of whatever. And that was really allopathic, even though it was supposed to be way in the future. So those things don't exist. The root cause may be very hard to determine, but you can still have an effect upon it. That's the thinking, that you can have an effect upon the root if you can just get close to it. So people are coming again, they're on that cyclotron. They've been told by their physician that there's nothing wrong with you, or you've got this or that, and here's your pills, which treats the paper. And so they're in the cyclotron. Those people, what do? If they go online, they're going to get a million hits on any condition you put in. You type in diabetes or thyroid or digestion disorder, whatever it is, you're going to get about a million things to look at. And or you'll go in your neighborhood and you find there's a guy down the street doing even naturopaths and some of folks, they do a diet program, they do an exercise program, they do a supplement therapy, they do some other therapy with some gizmo, and they're making a ton of money, kind of preying on people's uh, discomfort. The people are stuck in this cycle and they're getting pretty desperate, and they just want someone that can help them. So they're spending a ton of money. People are making a lot of money, but it's really not filling the needs. And the way we know that is people are still walking around with all their problems. If something besides what we do, and we're just catching on, really worked, then all these other people would be out of business. And that would be part of my objective, by the way, is to get more people doing what really works. Anyway, so you got this way of thinking that there's an underlying cause or condition, and how close can we get to it? And we can't give a medical diagnosis, and we don't want to. I have one diagnosis, and you might have heard this. I call it metabolic chaos. There's just things wrong in the body. Everyone has different weak links in metabolism. There are thousands and thousands of metabolic processes going on in the body 24 hours a day. And most of them are under control of the autonomic nervous system, your sympathetic and parasympathetic balance, of course, and all these other things going on. So there's this idea that if symptoms have occurred somewhere downstream, that's just how the problem is showing up. Upstream from that is dysfunction and dis-ease processes. And above that, just what I call metabolic chaos, just things aren't working the way they were designed to work. We assume the design is perfect. You don't have to teach any cells what their job is, certainly. You don't have to teach any tissue what kind of tissue it is. It knows if it's a brain tissue or adrenal tissue or muscle tissue, whatever. And so all the cells, tissues, organs, and systems know what their job is. It's just being interfered with in some way and not supported in some way. And everyone's so different. The opportunity for voids in that system, for weak links, is just really abundant. There's just millions of things that could be going wrong, and some of them all at once. So we have one diagnosis. It's metabolic chaos. There's stuff going on. And our way of looking at it, and this is just the discoveries that I made, Ashley, and I'm answering your question now. I run 5 labs in every person. And it's because all the people I tried to help, we started with a lady who had low bone density. And then, well, what helps with bone density? Well, the hormones. I started testing hormones. And what I found out just by working with people, sheer numbers, the people who had low bone density, when we worked on their hormones, not only could we help improve their bone density, but they felt better. They got more energy. Their brain fog went away. Their sex drive came back. Their weight normalized. Their not only that, but their immune system improved and detoxification. But still, it wasn't quite well. There's something else in there. So I learned to check for hormones in every person using saliva testing, and we check the immune system. You can use saliva testing for that. And I found out that when I ran another test, we call it the metabolic assessment profile, which is a urine test. We check digestion to make sure they're actually breaking down and absorbing food properly. And that leads you into dysbiosis and things going on in the gut that just aren't right. Also, detoxification. Is the liver clearing the blood the way it's supposed to? 3 pints of blood a minute go through the liver. 3 pints a minute. That's a lot of blood flowing through your liver. And most of that blood is supplied off of the digestive tract. So there is some blood coming from the rest of the body into the liver through an artery, but the rest of it it's sort of drained off of the digestive system. So you got all these things going on. Again, you can make observations. You can collect saliva. You can collect urine, and you can collect stool, and you can collect blood, of course, and start making observations. So this happened over a long period of time. I ran a ton of labs, and I narrowed it down to what will give me the most healing opportunities for the money. So people are going to invest. They have to pay me for my professional fees, and they have to pay for the lab work. Now, it sounds like, well, where am I going to get a lot of people who will do that? They're everywhere because people are sick. They're sick and tired of being on that cycle of trial and error, and they will spend out of their pocket. Last year, you said you were at 18. You're spending over $20,000 a year on what's so-called health care, like insurance, and it doesn't even cover the kind of healthcare that you want. It only really covers like emergencies.
Mm-hmm.
That's not a bad thing. But so maybe you should buy insurance for that only covers emergencies for $5,000 a year. That'd be reasonable. And the rest of the money you spend it where you want on care of the human frame and on diet and on the causes and prevention of disease. You could spend it a lot better and actually get everything covered that you want for your 20 grand. That's more than some people make, by the way. Some families of 3 or 4 people, at least in this country. And so you have the idea that you got this mindset. It's a methodology. It's a step-by-step process. I run those 5 labs on everyone: hormone, immune, digestion, detoxification, healing opportunities there, energy production, and the nervous autonomic balance. The sympathetic and parasympathetic have to be balanced for your body to function right. And we look for those opportunities. Now, some person we might find 10 things to work on, another person 5, someone else 15. It just depends on the person. Everyone is different. Everyone has these vital voids or weak links in metabolism. Again, we're not diagnosing and treating some specific disease. We're just saying, look, here's what's wrong with your body. And if you fix those things, then downstream, what you're seeing your doctor for, hypothyroidism or irritable bowel or chronic fatigue or fibromyalgia or brain fog, cloudy thinking, all those things, that stuff should go away if we fix everything upstream. So upstream, it's those. Matter of fact, you can remember it like this: the word hidden. I call them the hidden stressors and dysfunctions: hormone, immune, digestion, detoxification, energy production, and nervous system balance. HIDDEN. Easy to remember, right?
Mm-hmm.
Yeah, so HIDDEN, the hidden stressors and dysfunctions. You run a small handful of labs. They're not that expensive. You can get them done, and you have a professional. I've trained almost 3,000 people. Interpret those for you, because everyone's an individual, and it matters whose test results are these. That's another downside to allopathic medicine, is everyone's the same. All of their studies are on what's called a cohort. There's no one person that it applies to. It's, well, in a group of 50,000 people, we improved lifespan by 20% with this drug. Of course, 18 of those people died from the drug, and another 19 are permanently brain dead or something, some damage, something like that. But you get the point. So we don't work with cohorts. We work with individuals. And that's the other part of the methodology. It's a method, step by step, but it's a way of thinking about the human body and each person individually. So we look for these healing opportunities in the hidden HIDDN stressors and dysfunctions that I just determined over running thousands of labs on thousands of people will get you the best results. Will get you back to sleeping well, getting up, feet are hitting the floor, running. You got lots of energy to get through. If you eat your breakfast, you're going to have energy to get through to lunch, get a lot of good stuff done in between. Same thing between lunch and dinner. And then you're still going to have enough energy and clear thinking to enjoy your kids and all the stuff that we all want to do. In other words, real high quality life. And it's also preventative. You should be able to, my theory on anti-aging is that using that system, you should feel 40 until you're 80. So most of us, yeah, I'm telling you, look, I'm 66 years old. Yeah. So anti-aging you don't wait until you're 65, like I'm 66. And, thank God I started 20 years ago, when I was otherwise pretty much abusing my body without knowing. I call it a well-used body. I've done some bad things to it, but so I was trying to fit in this methodology with and also approach it as an anti-aging tool, but it will get you over the things that you're dealing with that you don't like about the way you look or feel, without going to a physician, getting a medical diagnosis and treatment of that specific thing with drugs or worse, surgery. So once you do this assessment, and it would include a very careful history taking, all of your complaints, what are the main ones you want to go away, how often those things bother you, how long has that been going on, what things have you tried first, and what's your motivation, how's this ruining your life, and things that we know you have to be a motivated client for us to take you on. But we would run those labs, and then we would individualize the protocols, design a DRESS program. I'd be very happy to go into more details on the labs if you want, like what hormones we look at or things, or like what markers, or we could go towards the dress program. How does that work?
Yeah, let's do
What
both.
other specific questions?
This is
Okay.
good. This is good. Let's
Hmm.
let's start with, because I know my listeners are probably on the edge of the seat going, yeah, tell us more about these labs. We have a Facebook
Hmm.
group, the Learn True Health Facebook group, and so many times people are asking about labs. But we have to have the right philosophy and mindset when looking at labs. We can't be reductionistic, which is like allopathic
Hmm.
medicine, just looking at, one thing. Like, I'm going to look at the liver, and that's very reductionistic, just to look at one
Hmm.
organ only. We need to look at the whole system, because every
Hmm.
organ affects the other. Every hormone affects everything affects everything, right? So we need to look at
Hmm.
everything as a
Yeah.
whole. So when you're looking at thyroid, and you're looking at cortisol, and liver, and digestion, energy, and sleep, and all this, right?
Yes.
What I'd love to know, if you could give some examples of labs, or what are the absolute must labs that you always run with people. Of course, it's
Hmm.
individualized, because one person comes to you and their health history is all about digestion. The other comes to you and it's all about headaches and maybe nervous system stuff. Doesn't seem related, but you dive in deeper and it absolutely could be related, because again, everything affects everything in the body. So we'd
Yes.
love you. Yeah, please explain more about these labs that people learn to run in the functional diagnostic nutrition course, and learn to run
Hmm.
on themselves and their clients.
Right. Well, again, back to the early days of doing the bone density testing, what I was finding was that I should look at hormones on every person. Now, again, I was doing it just specific to the bones, but I realized after a while, testing enough people, that wow, this is critical for all kinds of reasons, not just how it affects the bones, but how just what you just said, it affects everything. So we run a saliva test. We take a morning, noon, afternoon, and nighttime saliva sample, and we look at cortisol and DHEA. So cortisol is your stress hormone. And you can look at the pattern of cortisol and DHEA, which is a counter-regulatory steroid hormone to your stress hormones. You have stress hormones, which are catabolic. They break your body down. You're under stress. And then you have the anabolic, beginning with DHEA. That's the parent of your sex hormones. And so that's your anabolic. So you need catabolic and anabolic balance, the body building up and the body breaking down. There's a normal amount of each. Does that make sense? I mean, let's look at, catabolism. We find people are overly catabolic. They're cortisol dominant, so their bodies are breaking down. And it's not like you're going to treat the paper like, oh, here's something for the other side. We're not just going to prescribe or recommend. And there are supplements that would do that. You can treat the paper even in naturopathic medicine.
Mm-hmm.
But we start, obviously, what? Looking for the stressors. Why are you in this catabolic state? Is it just mental emotional? When I say the word stress, what do people think of? They hate their boss or their job or their kids. God, I don't know. Like they have mental emotional stress. But there's also physical trauma and things like aches and pains. Walk around in pain is very stressful. The body responds the same to either thing. Well, if your neck hurts, it responds with catabolism, cortisol dominance. If you are in fights with your spouse all the time, it responds the same way. And also the same thing with internal hidden stressors, the dysfunctions in your body that have occurred over time, or parasites, bacteria, funguses, viruses, or food sensitivities and things, and environmental influences. New draperies can cause hell in a household, because of the outgassing of chemicals and fire retardants and these things. So what we do is we look at that to assess the cortisol DHA ratio as a marker for catabolic anabolic balance, and go, we need to get this back in balance, or nothing else matters. Why treat one little thing downstream when we can go upstream to a major factor like that? And oh, by the way, so it would set us on a pathway of investigating the stressors, and they're some of that requires, again, the investigation, the intake, and careful history taking and things. Person might have a hobby that's actually hurting them. If they're spray painting little figurines in their garage, sucking up paint spray, that's not a good thing. But and you get the point. So there's investigation involved, including the lab work. We can look for food sensitivities, parasites, bacteria, funguses, viruses, and things that they don't even know is there, and physicians aren't looking for the most part. And so we look at a major thing like hormone balance, the catabolic, anabolic hormones. And also, while you're doing that, as long as you're collecting saliva, why not look at the sex hormones? Because estrogen needs to be in balance with progesterone in women, testosterone needs to be balanced. And we can even look at melatonin. That's not a sex hormone, but it's a hormone that's important. We can get that from the nighttime sample. So you can do a morning, noon, nighttime, and evening, morning, noon, afternoon, and nighttime saliva sample, get a lot of information. And frankly, again, standard physicians don't run that test. They're not looking for that. They're looking for disease. They're looking for a way to, cholesterol or whatever it is they're looking for, like depending on your complaint. So that's a pretty important test, a saliva test to cover those things. And again, this was just one of the first tests I started running because I was looking for a specific thing like bone density, but found out the ramifications of it by running thousands of them, and then giving those same people things to do, to look at the stressors. Well, let's run some more labs, and I narrowed it down to these 5 labs. So that's one. It's a hypothalamus pituitary adrenal stress indicator type test. We also run by the way, saliva is easy to collect at home and send in at your convenience, and it's not real expensive. And so it's a good investment, as is this urine testing we do. Again, easy to collect at home. We look at that digestive marker. Are you breaking down protein? Well, you can, by what you collect in the urine, you can see how well a person's breaking down protein. If you're not breaking down protein, it's the amino acids. Amino acids turned into neurotransmitters. Think of all the ramifications of having neurotransmitters out of balance, your moodiness, your irritability, and all the other things that are going on in your body that require good neurotransmitters. And all the other things amino acids are good for, like they're the building blocks of all the enzymes and tissues in your body and things like that. It's remarkable how important breaking down protein is. But that same marker if you're not breaking down protein, how well do you think you're breaking down your carbohydrates and your fats? And there's other ways to look at that, but it's a great test. And on the same lab, the same urine sample, again, we try to get the most bang for the buck. We can look at oxidative stress. That's another indicator of excessive stress of some form, toxins or something in your environment. You could be over-exercising, you could be smoking, you could be exposed to other toxins, or you could have hidden internal toxin-producing organisms or processes. So we look at oxidative stress. Basically, if you cut open an apple, it turns brown, right? That's oxidative stress. Oxygen, free radicals, and an excess of that is a bad sign. It's a great marker as an overall assessment of health. Something, again, physicians just aren't looking at because it's an insidious long-term contributor to chronic degenerative disease.
I did not know that you could do a urine test to see your oxidative stress. That's amazing. Just thinking about oxidative stress, one of the naturopaths that mentored me, it describes, he was a pathologist before he became a naturopath, and he says that cholesterol, the bad cholesterol, is oxidized cholesterol. It's oxidized fat. And so it doesn't cause disease in and of itself. It's like saying, look over there, there's smoke. It is the smoke. It's the effect of oxidation. And so if you take someone who eats fries every day, like fried and deep fried, that's a huge contributes hugely to oxidative stress to the body, is eating anything with oil and fried food. And so that person would then have higher levels of oxidative stress, but also people that are low in selenium, for example, because selenium recycles the body's own glutathione, which is our antioxidant. And so, I can see where you're starting to put the puzzle pieces together, because you're looking at their diet and their lifestyle. And then if you see that their melatonin is low in that saliva test, and then you see that their protein is low in that urine test, you're like, well, there you go. Their melatonin is low because they're not getting the amino acids that the body needs to make the melatonin. So you're starting to like be that detective. Am I
Hmm.
onto something here? Is that how it
You're
works?
yeah. Well, I'm impressed with your knowledge of oxidative stress. It's another form of stress that occurs when there's an imbalance between the free radicals and the body's ability to counteract them. Like that's why we take antioxidants, or we include antioxidants in our diet. You know, you need your vitamin C and D and E and these things from food, hopefully. But if not, you can take some. If you have excessive oxidative stress, you want to increase the antioxidants, but you also want to go. I mean, that's sort of the immediate care idea. But we don't want to just treat the paper or use the paper to sell our supplement program, and that's another unfortunate occurrence. But we want to find out, well, why? Again, it could be overexercise, smoking, or something else hidden. So we would just use it in that with that detective mentality, like here it is, here's a problem. Your oxidative versus antioxidative balance is off. You know, you have an imbalance. Let's correct it. So that's a pillar, as you mentioned, that can be corrected with our lifestyle program, the diet and supplements especially. But the right kind of exercise, getting the right amount of sleep, all these things are critical. So far we've looked at saliva tests of all the hormones, the anabolic and catabolic balance, the balance between all the sex hormones, getting a peak at melatonin, which has, I could fill in the blanks in there more. That's a great antioxidant, by the way. And most of it's made in the gut. People aren't aware of that. They think it's just from the pineal gland at nighttime. Not true. So you do this saliva test, you do this urine test. We said you can look at how well you're breaking down protein, which is reflective of how you're breaking down other things. It's also reflective of the dysbiotic condition we find in people's guts. You know, not enough good flora versus the bad flora. That's where a lot of your protein digestion comes from. It's the bacterial breakdown. So we're looking at that from a urine test, and on the same urine test we look at this oxidative stress. In the same urine test, we can look at liver function, and it's not the enzymes and things that physicians look at to see if you are diseased. It's just, is it congested? So if you're spilling these bile acid sulfates over into the urine, they're collected by the kidneys and excreted, and we can measure them. So if you have a congested liver, like before the recording started, we talked a little bit about that's an area that you might want to work on. We see people are overweight, and there's so much fatty liver around. It's unbelievable. So the liver, it does a lot of things, a couple hundred different operations. But if you just look at it as a vacuum cleaner bag, collecting toxins and unwanted particles off of the digestive tract and wherever, you got to change your vacuum cleaner bag, don't you? I mean, if you've ever changed the bag in a vacuum cleaner, the old ones that used to have bags, you know that it runs like a new vacuum cleaner when you change that bag. When it gets all stuffed up, it's not working. You put a new bag in it, you got a brand new vacuum cleaner. The liver could be, sort of assessed that way, and that's what's included in this urine test. So we've only run 2 tests. We haven't spent much money, but we've discovered a lot of healing opportunities. The catabolic anabolic imbalances, the sex hormone imbalances, the low melatonin could be a real problem for point to figure out gut dysfunction and things. We've looked at dysbiosis and protein and other food breakdown. We've looked at the oxidative stress. We've looked at liver congestion. That's a lot of bang for the buck. And and we haven't given any medical diagnosis. We're not playing doctor. We're just being like detectives trying to help people or ourselves figure out what's really wrong. Where can I clean myself up in these upstream functions so that downstream I just feel better. I have more energy and I lose the weight and I have a better ability to build muscle or sex life, whatever it is to you that you're not right about. The thing about the way you look or feel that you want to change. And that's only 2 tests. So, another really important one I run on just about everybody, depending on how they come to us, and people come with all this metabolic chaos. They've got multiple complaints. Hardly anyone says, "Oh, it's just my hangnail," or just, if I had a little more energy, I'd be better. Um, they've got multiple complaints. Some of them walk around with those things for years and years and years. And they've seen 10 people already. And everyone kind of picks and chooses, well, try my therapy, try my little machine, or my whatever they're doing, like individual therapies and modalities. Well, when that doesn't work, you got to start looking upstream. And that's what my entire system is based on. So I would look at gut function a little deeper. I like running an intestinal permeability test just to make sure that your villi, microvilli, are in good shape, that you don't have excessive permeability of the gut, things like that, because that can be pretty, well, it's a healing opportunity. It can cause all kinds of problems for a person, just unbelievable amount of problems, including eventually autoimmune conditions and serious, serious stuff. So when you run those, and that, by the way, is another urine test. Do it at home. It doesn't cost a lot, and you can get these markers and start doing the things it takes to repair the damage. And so there's two more tests. Matter of fact, if you just ran those three, you'd have a hell of an assessment. Wow, look at all this stuff that I can fix. Finally, someone is figuring out what's really wrong with me. And how do I fix it? Well, there's a couple more tests that would be critical in that process. Now we're ready for the DRESS program, but the easy way to shortcut, like diet, for instance, is to run a food sensitivity test. So we can get into the DRESS program now, but the other sort of hidden stressor is the parasites, bacteria, funguses. Those are easily detectable in stool testing. There's different ones. There's microscopy, there's a microscope. There's culturing. You can put the stool in petri dishes and see what kind of fuzz grows on it for bacteria or even yeast. And you can also run DNA testing. And so there's ways to look at the stool that are very, very informative, more healing opportunities. Like if you have bugs, you got to get rid of them. You can go to a doctor for that, or people mostly are choosing to self-treat using age-old, botanical treatments, more that are less toxic, less harmful to the good bacteria and things. So
I love that you brought
how
up.
do you like them apples
Yeah,
so
I
far?
like it. I like it. I like that it sounds really non-invasive. Saliva and urine test and stool tests, all things you can do at home and mail in.
Hmm.
Um, their mold and parasites are a huge problem that most people aren't aware of. Most people aren't aware that mold, they could live in several different states, and that, they can actually take mold with them in their belongings. And many houses in different states, even, out in the desert where you think, oh, it's not humid here. Absolutely, you can have mold in the desert, living in Las Vegas, for example, or living in the mountains. Mold is huge. It is a big problem for our health. I've had several experts on the show talk about it, and it can cause so many different symptoms, but obviously immune problems. Like if someone goes, man, I just catch every single flu and every single cold that comes around, I just feel like I'm always sick. Ding, 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 something's going on, that your immune system is just so taxed right now. What is going on? And of course, parasites, we think just because we have clean water and we wash our hands and, we don't live among filth like we did, a
Hmm.
1,000 years ago, that that we're somehow immune to parasites, right? Because, we live in indoors where there's no mosquitoes biting us every day. So we don't think that insects and, parasites are kind of like insects, right? If you think about it, could bug us. And yet, you go outside and you camp and you start to become aware that we are just animals. We are animals that are a little bit more sophisticated, but we are not impervious to parasites. And all animals can get parasitic infections like we can get a bacterial infection. So I'd love for you to just explain a little bit more about mold and parasites, because even if someone just had some health issues that are kind of persistent, it would be great to rule out. Because wouldn't it be wonderful if they discovered that their root cause was mold, or the root cause was, a chronic parasitic infection? And wouldn't that be wonderful? Because that's so easy to manage versus, well, everything's out of whack. Where do I start, right? Of course, do the diet, rest and exercise and stress reduction and supplements, to fill in the gaps. Obviously, 100% of the population would benefit from that formula. But wouldn't it be wonderful if someone's suffering and it's like an easy fix, right? To address mold and parasites rather than
Hmm.
years of, dialing stuff in and still suffering. So if you could tell us a bit more about the parasite and mold testing, that would be wonderful.
Okay, sure. So, in context with what I was saying, the investigation, looking at these critical markers for balance in your body, and moving on to then, well, what more specifically is part of this stress picture, this metabolic chaos going on in my body, and the things that you can do, like some of the testing to determine. Stool testing for parasites, bacteria, and fungus is common, and I mean, we just test everyone for that now, and you find things. But here's the issue I have with it. People think, oh, I found your problem. So there's people who sort of caught on to that there's parasites, for instance, or bacteria like H. pylori and these different things, some funguses and things. But they're thinking that they found the problem. And I'll take you back to the whole vitalistic theory. You were already sick for the most part before your symptoms occurred, and your immune system would have to be pretty compromised before some of these very common bugs. And by the way, if you look at some of the literature, they're not even considered a problem. They're considered commensal or sort of normal to have some bacteria and parasites. So when you can make a mistake easily by saying, oh, your problem sounds like parasites. Let's say you have some digestive issues and things like that, pain in the gut or whatever, diarrhea and things. Oh, it sounds like a parasite. Then you check and you pat yourself on the back. Yep, I found your problem. It's parasite. We'll get rid of it and you'll be fine. No, you have to heal the whole person. You have to heal the entire digestive tract and bring the immune system back into balance and order. So it's not as simplistic as oh, I found this parasite and now I'm all better. You might feel better initially, but you're going to get the next bug that comes along if you don't really repair the whole person. And mold is a little different because, and by the way, you can run a test. It's called, everyone should just jot down HERMI, the Hermy test, for mold in your house. Now, that's the sort of best test for finding out if you've got the kind of mold that will make you sick. And there's no good mold as far as being exposed to it, especially when it turns into something you can inhale. So if it turns into something that can be inhaled, that's a bad deal for anybody. And we recommend certain people with certain conditions. If you want to learn a lot about mold, I would go to survivingmold.com. Dr. Richie Shoemaker is probably the world's leading expert in that area of research. He's really specialized in water damaged buildings and the molds and the long-term chronic effects and how to remediate the building. Mostly you just want to get away from it. And then what happens to the body. Unfortunately, what happens to the body can be really convoluted, and the testing can be more expensive and hard to get for what it does to your immune system and the inflammatory processes in your body. It really wakes up some, they're called complementary pathways, and it can be really hard to detoxify mold. It's very insidious. It loves to just recirculate. It's very hard to bind and get out of the body. And it's not just because they're mold toxins. It's not the mold itself. They're just toxins from the mold. And there is what's called a mycotoxin test. You can measure for that, but it's not our first line test. I don't just automatically run a mycotoxin test on people. That we have to have cleaned them up first. So the FDN program, looking at the hormone, immune, digestion, detoxification, and so on, is a grounding program to get yourself all cleaned up where you should be better. You should be a whole lot better. And I'm talking in just 3 months, of doing the DRESS protocol. If you do our DRESS customized for your test results and your history, if you do that customized DRESS program, the diet, the rest, the exercise, the stress reduction, the supplementation, 90 days, you should really have turned a corner or made it a few steps up the ladder, so to speak. Like, yeah, I feel a lot better. Then we start getting into more insidious things that could be, in your environment. We don't change the mentality. We still just keep being good health detectives. But I'm not a person that automatically would just pick a test, like a mold test. I have some good screenings for it. There's a nasal swab you could do for MRSA things. That's pretty cheap, and but I wouldn't just run it as a first line. I just hate this idea. Actually, it's never worked for me anyway. Put it that way. To just try to guess what the problem is based on symptoms. Remember, we're trying to get away from that because people walk into the regular doctor or a regular naturopath and I've got this traditionally reliable cluster of symptoms. It sounds like thyroid, or a traditionally reliable cluster of symptoms that sounds like, chronic fatigue, or whatever it might be. Oh, let's run a test for that. And unfortunately, they find something that they say is the answer to your problem. It's hypothyroidism, and a doctor would write a prescription, and a naturopath would sell supplements. Helping to get the test results in range. You might even get the symptoms to abate, but something, they're either going to come back or a new set of symptoms occurs because you haven't really sorted out the chaos upstream. And when that chaos or new set of symptoms appear, if you just say, oh, well, now it sounds like low testosterone, well, running that test, and yep, it's low. So now you got a person. Yep, it's your low testosterone. So now you're on your thyroid medicine and your testosterone. And what's next? It's just a different cycle. It's just a new cycle of trial and error. And unfortunately, a lot of people deal with mold. They focus on that one thing, and they really don't address the entire person, including all the stressors, the mental, emotional, the physical trauma. Bodies that are all banged up, and that hidden. I would call that a major contributor to metabolic chaos. Mold really sucks.
Mm-hmm.
That's my medical diagnosis.
Very technical.
Yeah, we speak in big terms here.
I heard that parasite testing is a bit more complicated because parasites can hide in the body. How do you account for that?
Well, they do, and it's not just parasites. There's bacteria, and they like to hang out together. If you go back to what I said about it, even if you find a bug, if you think you're just going to take something and kill that bug and return to normal, it's unlikely. There are what are called biofilms, which is where they hang out together. There's what's called quorum sensing. The bugs know that the other bugs are there, and they kind of start hanging out together. They start not interbreeding, but that becomes fertile ground for them to replicate, to grow, and even to mutate. Like fungus mutates. You can get sort of what would be called normal spores and things, but once it takes hold, it can become very invasive, and punch holes in your intestines, for instance, and so it can get really bad. So what we do generally, again, this depends on the initial intake. Like, it's really important to take that history, and we have our own intake forms and things we use. Make sure our clients actually filling out a good number of forms. It sounds like a lot of work, but it probably doesn't take more than 15 minutes per form. Each form that we have people throw out 3 or 4 forms, and it's a good investment in helping us to, number one, take stock of where you are today. And as a practitioner, that's really important. We don't want them changing their mind about what their problem was 3 months down the road. Like, hey, we've been working on your migraines, and now all of a sudden you're complaining about your toenails are swollen or something. It's like, well, how are we doing? So you've got to get a good history, and you got to make people stop and think of where they're at, and you can grade those things too. So we do that, and that will have us then, run our labs and get people on the DRESS program, and their problems start to fade away. We actually have a point system for those intake forms. Someone might have 300 points, and in 90 days or 180 days, 6 months down the road, they're down to like not very many points. I mean, everyone has some points no matter what. So you've got that, which is both objective and subjective. You got the lab work, which is all objective, purely objective. It's what's really going on inside your body. And then you have progress being made. And, let's make a point here that no one's at the top of the hill. I don't know anyone with perfect health. I know everyone's on a stairway towards it, but I don't know too many people that, I've arrived. Here I am on the top of the mountain. But some of us have more stairs to climb than others. And we look up to the people who are sort of able to help us and guide us. And we look down and we help those with more steps up. We help people up. Like I personally, 66 years old, I have a very banged up body from sports, motorcycles, and just surfing, just things that I've kind of wrecked. Musculoskeletally mostly, but also during my 20s and 30s was exposed to a lot of chemicals in a different profession, different job I was in. I don't know exactly what that did to my liver, so I'm always watching. I'm always working. Again, I have less stairs to climb than most of my clients, and my students come along, and the same thing. So we're all just on a continuum of improving. And I don't know anyone at the top. So just with that mentality, let's look at what are the healing opportunities and what are the things I can do. And just I can answer more questions about the testing, but I wanted to talk a bit about the DRESS program.
Yes, we'll definitely get into that. Absolutely. Before we do, I have one last question about labs, and that's lab companies. I've heard stories about how it can vary, results can vary from lab to lab. Do you have one company you work with, or do you have a handful of companies like Doctors Data, for example, or Great Plains Labs? Do you have a handful that you're like, I really find that these labs are the best in terms of results, or do you have one specific lab that is just the best? I'd love for you to shed a bit of light on that.
And the answer is that it depends on what you're testing for. There's no lab that's a specialist in every kind of testing or for everything. So there are companies, all they do is genetic testing. That's all they do. And I mean, you could even just run the 23andMe, and then, which is cheap, and then you could run it through various software. There's one called Prometheus that I like, but there's others. And here's the hard thing about my job is that there's new stuff coming out all the time. It's hard to be on top of every new discovery and research and things that are going on. And half of them could be junk, because there's no end to the amount of money being spent in this industry. So I do my best to vet out things, and there's a company called BioHealth Laboratories. I've been using them for 20 years because I think they do the best saliva testing, for that HPA Access stress profile. I think they're the best. And I mean, the quality and the quality assurance, and I've been working for them or with them for 20 years. And I'm actually a clinical advisor on their clinical advisor team. So, but Great Plains, you mentioned them. They're a great lab. I use them for the mycotoxin testing. They also have a finger stick test for food sensitivity. It's not the best food sensitivity test, but if there's nothing else around, it could be shipped anywhere in the world. You prick your finger, you put drops of blood on the blotter, you send it into the company. It doesn't have to be frozen or anything like that. It's stable for, a week in the mail. It would be okay. And you get a rough idea of the foods that you're sensitive to. It helps you fine tune your diet. So you mentioned Doctor's Data; they're a good lab. By the way, this Biohealth Laboratories has an excellent stool test for pathology. For pathology, is there other stuff you could run a stool test for? Yes, and Biohealth just doesn't run those other parts of the testing. So um, there's DSL, which is a good test. They do DNA testing on stool. So the answer to your question is it's various labs for depending on what you're looking for.
And you'd want DNA lab testing on stool because you're DNA testing not for human DNA, you're DNA testing for parasites. Is that correct?
The bugs,
Yeah.
yes,
Okay.
yes, but the mere presence of their DNA. This is why I like some of the other testing. Isn't telling you really how virulent it is. When you run a stool test and you culture, so they take the stool and they shake it up real good and they mix it with a couple of things and it becomes like a puree, and then they're able to put it in these petri dishes. Like they can grow 8 different dishes with different mediums or agar in each dish, put it in an incubator for a few days and see what grows. And depending on the medium, you get it growing different fuzzes. Well, if there's a little bit of fuzz or a lot of fuzz, that can make a difference in your individual assessment of that person and what they need to do next. Also, microscopy. There's sometimes just looking through these high-powered microscopes that just having a really good lab rat, and that's his job or her job, and she just sits there and looks for bugs or bug parts and little things. Sometimes a human being involved is pretty important. So there's various types of stool testing, and DNA is bandied about as the ultimate best because it's looking for non-human material, and yet and by the way, it can look for that same test looks for um, other markers that could be reflecting how well you're digesting things, how much pancreatic enzymes you have, and so there's a lot of ways to skin the cat. So once you're trained in the basics, then you can start looking into the finer details and individualize the labs you choose for each individual person. Again, it's never about the test results. Really, it's whose test results are these. That's part of that methodology and mentality. So yeah, I've compared a lot of labs. I like Oxford Biomedical for food sensitivity testing. They run what's called the mediator release test. Unfortunately, it's not covered by insurance, and most of this isn't, because even though that test has been used for 25 years, it's still called experimental by insurance
Oh
companies.
my gosh.
Why? Yeah, why? Because they don't want to pay for it. But it's been one. That was the test. Remember, I told you about the kind of miracle case, Susan, with the depression, and She's got the hives for 2 years, and has been on this anti-inflammatory that made her gain 40 pounds, and that's the test I ran that found her problem.
Mm-hmm.
It's like, now I run it every per. Do you always hit home runs out of the park by running that test? No, because people can have food sensitivities, and it's the major factor in their problem. Like migraines, I've seen that just migraines gone.
Mm-hmm.
But now other people, the food sensitivities aren't that big a contributor to the metabolic chaos. They're a minor contributor to the metabolic chaos that's producing the symptoms downstream. For one little boy, I got to tell you, this is way back in the day. Um, a lady was in for chiropractic, and we were talking, and her own health. It's always about her. And she says, I just wonder if you could help my boy Billy. He's 9 or 10, and he's always in trouble at school. They want to put him on drugs
Mm-hmm.
for ADD. Here we have teachers diagnosing in the classroom, and they want to put him on drugs for ADD because instead of paying attention to the teacher, he's paying attention to the gardeners working outside or something. He's doing something with his little brain. Anyway, we just did that test on that boy, got him off certain foods. Some of them are obvious, the highly colored and sugared cereals and all that stuff. But guess what? In 2 weeks, the principal of the school tracked me down and said, "What did you put Billy on?" And I said, "We didn't put him on anything, man. We ran a test, got him off the crap, and now he's a better behaved kid."
Mm-hmm.
And so things like that, just to me, to you and I, actually, that's just common sense, it's not always commonly practiced. So That's why I love labs. They just can, to the degree that that finding is contributing to metabolic chaos, is the degree to which it's useful in reversing the metabolic chaos and creating order. Especially in that hormone immune digestion, detoxification, and so on in those areas.
I love it. I'd love to know, have you, and you mentioned earlier, sometimes we'll never find the root cause, but we'll be able to help the person. But for example, my son who was having asthma, and he is so healthy and he eats so healthy, and I'm thinking, what is going on? And we changed pediatricians. We went from, well, of course, naturopathic pediatricians. We changed pediatricians, and the one we went to, the new one, goes, her first, after being hospitalized twice for asthma, she goes, why don't we do food testing? Like, that's her first response. Like, we should be testing him for allergies. And I'm like, wow,
Hmm.
like, thank you. And I brought it up with the first pediatrician, and she was like, well, that's down the road. And I'm like, what is going on? She started telling me it's normal for kids to be sick and to have, I mean, asthma. It's just like weird, right? It's what some doctors will say. And sure enough, he is
Yeah.
allergic to 7 foods: garlic, fish, like
Mm.
almost every single kind of fish, like
Mm.
set him off.
Hmm.
Eggs, avocado, things that he would eat every day. Like, he ate
Mm.
avocado, he loved avocado, ate it every day. Garlic's in everything, and a handful of other
Hmm.
foods. Things that we also would avoid, like dairy and oats. But he was allergic to and if he had any exposure to these foods, he'd have asthma and dust mites. Which, dust mites are easy to manage, but these, like, garlic's really hard. Like, so all of his food is made at home, cooked from scratch, and or I have to be totally diligent with looking at the ingredients. But I'm wondering, and so now he doesn't have any asthma, by the way. So, but if he has any exposure, he starts to get a little wheezy, and then we go, okay, now we gotta be diligent. But that's so there's an early warning system. His body lets us know. He starts coughing, has a little bit of wheezing, and then we really make sure that we vacuum twice a day, that kind of thing, and make sure that his food is 100% clean, in case he accidentally ate something contaminated with eggs or with garlic. But I'd love to know what causes people to have these food allergies. Like you said, we may not ever get to that kind of level of root cause, but in your testing, do you see something that says, like, do you see, like, oh, here's leaky gut, and that's what caused, like, do you see that there is evidence for something even deeper than the food sensitivities that causes them?
Yeah, again, there are inborn errors in metabolism. There are weak links in metabolism. Much of them are acquired, but some are inborn. And there's this, I just have to use the word milieu of factors. And that's why I use the phrase metabolic chaos. And
Mm-hmm.
the root cause exactly may not be known, or discoverable. It's too far upstream. There's not a test. The test sometimes is getting off of food and seeing if you feel better. I mean, that's
Yes.
a really good one.
Yeah, because there's no side effects.
Yeah. Yeah, and there's no diagnosis in the food sensitivity. I coached football for 15 years, youth football. And I can remember, this is again early on, which made me just so proud, and know that I was heading in the right direction. I didn't have it all figured out. Same test. So I had a kid, the moms always come up, oh, the boy, he can't practice today on Wednesday. And I said, well, he's not going to play Saturday then. Anyone who doesn't practice won't know the plays, and he'll have to sit out Saturday. And she's, oh, but he's got asthma. I said, well, what are you doing about that? Oh, he has an inhaler and he takes his inhaler, but we don't allow those on the football field. And so I just said, well, have you ever had him tested for food sensitivities or anything like that? This kid, within a very short period of time, never had asthma again. I
Mm-hmm.
still see that kid around town sometimes. And now he's a big, strapping, grown man with no asthma. It was so miraculous. She had her other kids tested. Like I'm going to test the whole family. Oh yeah, maybe that's a good idea. Depending. So there's just ways to be. It's the mentality that I think we've covered pretty well here, of always looking for the hidden contributor to metabolic chaos. And to the degree that the root cause is discoverable, we can work on it. If it's not discoverable, if it's just too hidden, we can still have an effect upon it by getting, what are the healing opportunities? What healing opportunities can we identify? And my system is based on just years and years and years of observations. If you check the hormones, the immune system, digestion, detoxification pathways, energy production, and which is, I'll tell you about that in a minute when we go over diet. And then, of course, the nervous, again, this idea of autonomic balance, sympathy. Those 6 things, the hidden stressors and dysfunctions, are answering almost every case that comes in. There are additional work to be done sometimes, but they're less common. So most people, with all the common things that people complain about today that are generally considered chronic degenerative diseases or conditions, that's our wheelhouse.
Love it. And it's such a big wheelhouse. Oh my gosh. Pretty much the
Yeah,
whole
it's millions of
population could come
people.
see you and get results.
A guy from a guy called me up and he wanted to know if he should take the course, and he's a practitioner, and he goes, well, I don't know if I'll find enough people to work on. Like, will there be enough people to work on if that's the. So I said, hey, where do you live? He goes, New Jersey. I said, no, there's not enough sick people in New Jersey. like what a joke, like there's just you're never going to run out of customers. So, and they're going to pass the word, by the way. We have FDN practitioners spend the least amount on marketing. Why? Because we get results, and we all have referral-based practices. So I wanted to, before we go on too much longer, just to talk at least about the D in the DRESS program and anything else you want. But diet is really one of the biggest questions. I mean, how many diets are there out there? 100, 1,000? I don't know. But there's no one of them that is right for every person. I guarantee you that there's no one diet that's right for everybody. So what in the hell do you do? By the way, this was something I spent a long time trying to overcome, this question, because I knew people had to go, you're made of food. How do I get people to eat right? I started off, it just happened to be the diet of the day in 1999 when I started this was the Atkins diet. Everybody was on the Atkins diet. Well, it was making some people sick.
Mm-hmm.
Why is that? So I want to know, well, why is this person does Atkins and, oh man, losing weight, feeling more energy and doing great. Another person's like, I got sick. I had no energy. I didn't lose a single pound. Matter of fact, my skin flared up and I felt worse. So why is that? Well, it's because we're all unique individuals with different, I'm going to use this phrase here, metabolic types. So a metabolic type is simply meeting your genetic requirements. We're all from somewhere, and if we all could go back, 500 generations, which is a long time ago, you'd probably find your correct metabolic type and diet that goes along with it. If you're Mediterranean, that would make sense. If you're, you have people today touting the paleo diet, which they think means eat more meat. Well, if you're from the Anglo-Saxon heritage, Eastern Europe, and these kind of places where 500 generations ago there was lots of hunting and gathering going on, and your people lived on deer and rabbits and muskox and mammoth or whatever, and that's just about all they ate, along with some local flora, seasonal plant material, and you ate just that, and that was your heritage, and it wasn't mixed with any other heritage. You probably would do pretty good on that. But what if you're from the island of Borneo? That diet would be horrible for you. And so there just isn't one diet that's right for everyone, but there is a way to discover it. And there's some principles involved in that way to eat that are really, really critical that I learned. And I think it's really important, since I have the opportunity to share, 3 things you need to know. Okay, so you have macronutrients, protein, fat, and carbohydrates. And they're the fuel that your cells burn for energy so that that cell can do its job. The cells don't have to be taught anything. They know what to do. It's an innate intelligence. It's the same intelligence, by the way, that keeps the earth in alignment with the sun and the sun in alignment with the rest of the solar, universe and everything like that. So there is this innate intelligence that hangs everything together. Everything's happened all at one time, and your cells know that stuff, and they know if they're a brain cell, muscle cell, adrenal gland cell, or whatever. And so if you can fuel them properly, which requires the right mixture of the macronutrients, the protein, fat, and carbs. You've heard of protein types and you've heard of carb types, and there are such things. There are people in the middle, what we call a mixed type. So it has to do with the oxidative rate, the rate at which your rate and quality and quantity of energy being produced on a cellular level. So energy is produced on a cellular level, and it's mostly dictated by the fat, carbon, protein ratios. So you can dial it in. You can dial it in almost perfectly. There would be some variations based on the time of the month for women and seasonal variations for some people. But otherwise, you can really dial in the correct fuel mixture for you. Because if it was as simple as, eat the way your ancestors did 500 years ago, that food's not available. And guess what? People 12,000 years ago started roaming the world, and we're all just really interbred. There's very few pure this or that or anything except in native tribes, and they've been studied. So a really big thing is the protein, fat, and carb ratios. Do you kind of fill me on that?
Yes, absolutely. And I've looked at that in terms of how to get better results for people, and you would change the ratios if someone was an athlete and wanted to get a different performance, right? Versus a woman who wants to lose weight that is less active, for example. And so you can adjust and play with those ratios, the grams of carbohydrates, fats, and protein to make the fuel mixture that your body wants. If you're a sports car or a little minivan, right? So your metabolic needs, as you were saying, and your genetic predisposition, but also the quality of carbohydrates matter. Quality of protein,
Oh, yeah.
whether the protein is from something highly processed like whey or meat versus a protein in broccoli. So we can, just a different quality of proteins and all of the nutrients that come with that food, we need to take into account as well. And so we need to know the highest quality of the fuel, right? And the ratios are really important. But I love that you're talking about getting those ratios in a healthy mixture for the body and not being extremist with these 80% or 90% fat diets or these carnivore 100% meat diets where the ratios are way out of balance, and maybe in a short term someone can get good
Hmm.
results. Anyone can lose 10 pounds changing their diet. It kind of shocks the body, shocks the metabolism.
Hmm.
But it's what you see in the long term. And I like that you're looking at subjective and objective by looking at how the person is feeling in their own skin and the labs, because over time you're going to track a diet and see if you're getting the results you want or not.
Well, that's really well put. Let's take it just a little bit step further with this energy production on a cellular level based on the carb, fat, and protein ratios. We're going to assume automatically that you're eating really good, high quality food, that your beef or whatever your meat is organic, that your fruits and vegetables are as organic as you can get. Not that they have so much extra nutrition in those fruits and vegetables, but at least you're not getting the herbicides and pesticides, rodenticides, all the different things. You want to keep poisons to a minimum, right? But this is what people should write down in terms of, well, how do I know if that's the right fuel mixture for me? Number one, you're going to be satiated. You're going to feel satisfied. Your meal will have felt like the right kind of a meal. You can start with breakfast. You can start with lunch, any day of the week you want, and just try to measure about an hour and a half or even 2 hours later if you had a reasonably sized meal. What is your satiation? It's the principle of satiety. If you're not fully satisfied, if something's missing, if you're craving something, then we'd want to adjust those ratios a little bit. No, I'm not feeling satisfied. There's something missing. That's not satiation. So satiation becomes a really important factor. And again, you should make notes. You could what you had for breakfast, and an hour and a half, 90 minutes later, check three things. One is satiety or satiation, or versus cravings and or hunger or something. Again, assuming you had a real meal, not just a snack. The next thing is energy. So you need really good, high quality, strong energy from your food. It should, again, if it's fuel for the cells and they're producing energy to do their job, you should feel energized and energetic. You should have enough energy to do the work or play that you plan to do until the next meal comes along, which case, by the way, you should feel a little bit hungry before your next meal. Your blood sugar could be checked and things like that. But so satiation is one, should feel fully satisfied. An hour and a half, 2 hours later, you should still feel good energy. I'm not talking about the kind you get from coffee where you're kind of nervous, but you can do something, but you feel tired underneath. Not that kind of energy. Real strong, solid, good energy. And the third thing, again, these are worth writing down if you're going to try to adjust your carb, protein, and fat ratios. The next one is sense of well-being. Believe it or not, you should feel good. If you feel really grumpy for no reason, then that's a sign that your meal may need some tweaking in terms of protein, right? I mean, if you're grumpy and someone just cut you off in traffic, or you just got in a fight at work or something, that's kind of okay. But if you are everything's going along and well, why do I feel grumpy? Or irritated, or one of these kind of negative emotions. In other words, you lack of sense of well-being in any way. And those three things are really critical, and it requires you being a bit self-aware and paying attention and maybe making some notes so that the next day you can adjust that ratio. There's lots more to diet, but that's some really critical factors. And again, assuming your food is high quality, you're not eating crap out of bags and boxes all the time. You want to eat real food. The stuff that's on the outside of the grocery store, on the edges.
Right.
Stay out of the aisles.
Stay out of the aisles. Go right? Shop around the perimeter of the grocery store. Absolutely. I love it. Yeah. Very cool. Yeah. There's so much to this, but you make it simple. It's a delight learning from you, and I'd love to have you back on the show because we've just really scratched the surface. I'd love to have you back to dive in. Mm-hmm. I know my listeners are going to love today's interview, and I know they'll love to have you back. I want to make sure that people know more about your course. I'm going to take your course. I'm really, interested, and awesome. I know my listeners are right there with me. For those who want to check out the course, they can go to learntruehealth.com/FDN, like as in functional diagnostic nutrition. So learntruehealth.com/FDN. And of course, that link is going to be in the show notes of today's podcast at learntruehealth.com. Tell us a bit about your course. Now, I believe when they go to that link, they'll get a discount to your program. That's sure. What it says. And I'd love for people to know a bit about the program. It's self-paced, is my understanding. So, because we're all busy, right? So it's online and it's self-paced. Right. Can you tell us a little bit about it?
Oh, sure. It's quite a robust course. As I mentioned earlier in the program, I've interviewed every person that ever took it. It started as a 2-day workshop, and that was 11 years ago, July, so a long time ago. And I've just expanded and expanded and expanded. What more can I do? What can I do to make it better? And every person gets asked, and I've had a lot of honest people who told me, what if you did this? What if you did that? So I take all that under advisement, and I've reiterated the course to now. It's a full-blown course in First of all, obviously the labs, all the investigative processes, the hormone, immune, digestion, detoxification. I teach the anatomy, physiology, and biochemistry. For those that already know some of that stuff, it's a great review. And for those that know anything, I speak in very plain language and teach you what you need to know. There's no fluff or frills or fill in this course. It's all practical stuff. And I've been told by people with master's programs and PhD programs said this is the most practical thing I've ever done, ever,
Love it.
because it's just nitty gritty stuff. So it's all the physiology and stuff around the lab work. So you truly understand what you're testing, what are the hormones and the other markers, and how to interpret them based on an individual. Where we focus is on the case studies and how this is an individual's test results. It's not treat the paper. That would be easy to teach. I could teach you that in 10 minutes. This is, again, a robust course that takes about 6 months or more to get through. I've had people do it in less, but they must have had nothing else to do. So if you, so it's all of that. Then of course it's going to be, again, case studies and interpretation and working with individuals and yourself. You're going to run those labs on yourself. I pay for 2 of them as part of the course. So I'm paying your way for some of that internal investigation on you. You could take it just for your own health if you want to. That alone would be worth the price of admission. But so I'll teach you all that, and then I teach you all the protocols, the DRESS program. We just went into diet, a fraction of what you might want to know. So it's how to get the right diet for each individual, and the rest program. And I teach a lot about sleep that's really important, and about the exercise. You just said some people are like drag racers, and others are like Volkswagens. There is no one exercise program that works perfect for everybody. You got to know some things. Now, you might not be a personal trainer actually putting them through those things, but you'll be able to teach your client or yourself the right way to figure it out. And so it's the diet, the rest, the exercise. The stress reduction is one of the biggest modules because there's so much variety in the types of stressors we're affected by. Some of that I go back to my early days of the environmental work I used to do and what's in the environment. Other parts are the food sensitivities. Other parts are the just the common things around your house. Matter of fact, for people who just want to taste of how to deal with that area in their lives, go to the Environmental Working Group. .com. I think it's EWG. It might be .org. Environmental Working Group. Look them up. We get a lot of our stuff about the environmental toxins and pollutants from them. So it's diet, rest, exercise, stress reduction, how to assess an individual and the various stressors. And then, of course, supplements. I don't know my own line, which I think is to my credit, because I know I'm leaving a lot of money on the table not having my own line. But I just have avoided that. But I know a lot about supplements, and I teach you what you need to know to support the body, to stimulate the immune system, to substitute for what's missing from food, for gosh sakes. Those antioxidants and essential fatty acids and things that we talked about, the vitamins and minerals and things. So that's really important stuff. So it's not only all the lab work and assessments and how to work with individuals and yourself, it's all the dress protocol. Like, what fixes everything? How do you fix every cell, tissue, system in the body at once? And that's the dress modules. And then, of course, there's the business modules, like how to do this for a living, how to work with people, how to intake, how to make sure you're working with a client who's going to be successful. Or guess what? Don't let them hire you. I teach you how to actually select people who are going to be successful and make a good living doing this, doing the good in the world that all of us want to do.
Oh, I love it. It sounds amazing. I took the IIN course and I really appreciated it because its focus is on the emotional mental health of doing health coaching. Of course, you learn the dietary theories of 100 different diets, but you don't learn labs and you don't learn supplements. You don't, learn nutrition. I've been mentored by naturopaths for the last 8 years, so I've learned a great deal about nutrition and supplements. But what I loved about IIN's course was it's a lot of it is the emotional mental work. And so I see that someone who's graduated from IIN as a health coach would love to take your program because like you said, there's no fluff. It's 100% everything you want to learn. to then go out and work with clients. And so people who have never worked with clients could take your course and do a great job. And people who do currently work with clients like IIN graduates, it would complement their continuing education so well. I think it's a wonderful
Mm-hmm.
compliment. So I'm very excited to take your program. And thinking about the cost of your program and thinking about the cost of seeing a functional medicine practitioner, for example, it's about the same. You know, that you to see someone for 6 months or a year, right, to work on problem, I could pay someone else. Like I could find a local practitioner, maybe a graduate of your course, and I could pay them and do the testing and pay them to sort of look at it and assess me and help me figure out what I want to do. Or I could pay to take your course, to learn it myself, to do the work on me, and it'd be about the same amount of money, but I would have that skill set for the rest of my life to continue helping myself for the rest of my life. And, you know, some people are just at a
Mm-hmm.
point where maybe they don't have the mental clarity. Like I remember when I was very sick with chronic adrenal fatigue, I did not have the capacity to take a course, right? So that I was just at that point where I just wanted someone to help me. And maybe people are just, they just want to find a practitioner that's taken your course and go and work with them. But for those who want to sort of be taught how to fish instead of just be given a fish, so they have that skill set for the rest of their life, then taking your course is absolutely amazing because it's in the long run is going to save them so much money years to come. They can apply these lessons to themselves and their family and their loved ones, and then have that background of potentially also doing it as a career or adding it to their repertoire. Wonderful, I love it. And is it audio, video? Tell us a little bit about the format of experiencing your course.
Well, it's online for the most part, but there are quite a number of head-to-heads with or one-on-ones with mentors. So some of my best students who just and that's how I've grown, by the way, from the original 2-day workshop. I had 19 people. We now have close to 3,000 that we've trained, and of course, it's been reiterated over and over again. The latest iteration is quite remarkable, if I do say so myself. And so it's you're going to watch the lessons. You can download them to your computer though, so you don't have to be online. You could watch them on a bus or on a plane, or as long as they're on your computer. There's printouts, and I have I think 180 different forms I give you, including the legal documents and onboarding things, and ways to complete the assessment, develop the DRIS program, and apply it to a person. The coaching method. You mentioned IAN, which is a good school, and just about every other health coaching program or institute, whatever it might be out there. There's tons of them now. I remember when there's two or three, and so we were one of the earliest, been around the longest. But there's some good ones out there. But I would consider them to be, if they were a bachelor's program, we would be the master's program. So we are the next level. But I break it down in such a way, and again, I said there's such a thorough, for those that know a few things, that it would be a great review. For others who haven't been exposed, it'd be good for everybody. The only prerequisites are that you want to help yourself and others, and you're willing to walk the talk. So if you want to help people and you're willing to walk the talk, set an example, it's an amazing opportunity to learn. Again, if you only worked on yourself and your family, it'd be worth the price of admission. But the fact that you could turn around and recoup your investment in a very, very short period of time, if you follow my business model, it's pretty remarkable. And last but not least, it's a community now. It took on a life of its own years ago. Even the first class, there's some alumni that still are there, still doing things. So the alumni group, which I formed officially, we have an official alumni group. We started, I think, 2.5 years ago. And there's hundreds of members. These are the people that do this seriously for a living. And like we have a convention every year now, where we hang out and share. It's really remarkable. I've been told by some of my mastermind people, don't start a tribe and not lead it. So I'm here for the rest of my life, folks, to kind of lead the charge, and in my way, just like Ashley is in her way, and we all know what the goal is. It's for health and wellness and happiness of the planet. If you go back to that quote from Thomas Edison, doctors aren't getting there. They're not evolving. Matter of fact, many are getting more entrenched in just the diagnose treat model. We have to present something to go side by side with that people really want, that really gets them where they want to go.
I love it. Oh, I'm so, so excited. And my listeners love reaching out to me and telling me, how it goes for them, especially when they become a health coach. Several have become health coaches as a result of listening to my show and hearing my journey through IIN. I've had 3 people email me saying that they were going to become MDs and they quit med school and they became naturopaths instead because of my show. They found their true calling, which is so cool that people are finding their true calling through listening. And so I'm really looking forward to hearing in the coming weeks and months from my listeners who take your program. Go to learntruehealth.com/FDN and take your program and then have an amazing experience. And then they'll reach out to me and say, this is how it affected my life. Thank you. And they'd love to just, let me know how it went for them. And so I'm really looking forward to hearing the stories because your program is results based, and it's all about results. It's why you do all the labs so that you can move the needle, right? So you can get results. It's not so you can just prescribe a drug, right?
Exactly. Yes, and the community is amazing. It is made us what we would call today group sourced. So if your feedback from people is, "Wow, that was great. What if you did this? What if you did that?" You actually have some ear. There's people listening, including me. Like, where else can we take this? And there's new technology coming on board all the time too. There's new labs, new products, new things that we can play with. Like the big thing today is wearables. The wristbands and the rings and different things. So there's always something new that fits right in. That I can't be the eyes and the all seeing. It takes a group to do something like this, to make it a true movement. So I hope we get some great feedback. And if we get any great ideas, that's even better.
I love it. Wonderful. Well, my listeners have always been so impressed by them that they are a people that take action. They're action oriented people. So I'm looking forward to you hearing the wonderful feedback, as am I. Definitely listeners, go to learntruehealth.com/FDN to look into it, see more information and see if it's right for you. I'm really excited to take your course as well. And, wouldn't it be wonderful if 100% of the population knew like this information? Could you imagine a world where everyone knew the labs that they could take to better themselves, and just if everyone knew like, wow, I have this symptom, maybe I need to look in this direction. How self-sufficient would we be? It's a big threat to the companies that don't want us to be self-sufficient.
Yeah, I think it's called empowerment, but it comes with self-awareness first, and having a space in your own head or being to be at peace. You got to know what that looks like and set goals for yourself. That's what health coaches are supposed to do, but it has to begin with us. Again, the prerequisites are you want to help others, and you will be willing to walk the talk. So we are a pretty self-aware group, a pretty high level of consciousness among most. We make money, but we're not in it for the money, and it's just so rewarding.
Wonderful. Well, excellent. Thank you so much for coming on the show. Please come back. I'd love to dive deeper.
Yeah.
There's so many topics that you have to
Okay.
teach, and I'd love to dive deeper. It's been wonderful having you on the show.
Perfect. Thanks, Ashley. Happy to be here. Glad to come back anytime.